You wake up in the middle of the night again, third time this week. As you pad across the cool floor to the bathroom, you're thinking about how this never used to happen. But hey, you're in your 60s now. These things are normal, right? The next morning, you're enjoying your coffee when you remember that uncomfortable moment yesterday. You know the one I'm talking about. Maybe it was during a private moment when something just didn't feel the way it used to. Or perhaps it was that nagging sensation that your bladder never quite empties completely anymore. You shake it off, telling yourself it's just part of getting older. But what if I told you that some of the most common habits men have, habits they've been doing for decades in complete privacy, might actually be making these problems worse? What if the very things you think are harmless or even healthy could be secretly damaging one of your body's most important glands? I know this isn't the kind of conversation most guys have over a beer or at the golf course. Nobody talks about this stuff, do they? We just assume that whatever's happening down there is inevitable, that it's just the price we pay for getting older. But that's not the whole story. Here's what I want you to understand by the time we finish talking today. Your prostate, that walnut-sized gland that you probably never thought much about until recently, is still very much under your control. The choices you make in private, the techniques you use, even the products you reach for, can either protect your prostate health or gradually damage it. And the crazy part? Most men have no idea they're making mistakes that could affect their health for years to come. So let's have an honest conversation. No judgment, no embarrassment, just straight talk about something that affects millions of men but rarely gets discussed openly. Because your prostate health isn't just about comfort. It's about maintaining your independence, your confidence, and yes, your ability to enjoy intimate moments well into your golden years. Let's start with something that most men don't fully grasp. What exactly happens to your prostate as you age, and why it matters more than you might think. When you were in your 20s and 30s, your prostate was about the size of a walnut, weighing roughly 20 to 30 grams. It did its job quietly, producing the fluid that makes up about 30% of your semen, and you probably never gave it a second thought. But here's what most men don't realize. Your prostate never stops growing. It's actually one of the only organs in your body that continues to enlarge throughout your entire life. This isn't some medical anomaly or sign that something's wrong. It's as natural and inevitable as getting gray hair, needing reading glasses, or finding that you can't quite hear the television as well as you used to. By the time you reach 60, there's a 50% chance your prostate has grown significantly. Think about that for a moment. 1 in 2 men your age are dealing with this. By age 70, that number jumps to 70%, and by 85, nearly 90% of men have what doctors call an enlarged prostate. This condition has a name, benign prostatic hyperplasia, or BPH, but don't let the medical terminology scare you. The word benign means it's not cancer, and hyperplasia simply means growth. The water still comes out, but it's weaker, takes longer, and never feels like you're getting the full flow you expect. That's essentially what's happening inside your body. Now, this is where certain habits, particularly around masturbation and sexual activity, can either help you manage this natural change or make things significantly worse. Your body is trying to adapt to these changes, and what you do in private can either support that adaptation or work against it. The difference between men who age gracefully with minimal prostate problems and those who struggle with constant discomfort often comes down to understanding these changes and adjusting their habits accordingly. Now, let's dive into the first major mistake men over 60 make, and I'll bet it's not what you're expecting. It's all about pressure, specifically using too much force or overly aggressive techniques during self-pleasure. You see, your prostate at 60 isn't the same resilient organ it was at 25. The tissues have become more delicate, the blood vessels more fragile, and the protective membranes thinner. It's kind of like the difference between a young tree that can bend in a storm and an older tree that might snap under the same pressure. Here's something that really opened my eyes to this issue. Vigorous prostate stimulation can cause serious problems, including bleeding around the prostate. It can also lead to infections, tissue damage, and in some cases, if you already have undiagnosed prostate cancer, it could potentially disturb cancer cells. I know that sounds scary, but stay with me because the solution isn't to stop everything. It's to be smarter about how you approach things. Think of it this way. If you had a bruise on your arm, you wouldn't keep pressing on it hard, would you? Of course not. Well, many men over 60 already have some inflammation in their prostate due to the natural aging process. It's not necessarily painful or even noticeable, but it's there. Adding aggressive pressure to an already sensitive organ is like adding fuel to a fire. Here's what happens when men get this wrong. They might experience pain during or after ejaculation, notice blood in their semen, or develop what feels like a constant ache in their pelvic area. Some men develop chronic prostatitis, that's ongoing inflammation of the prostate, which can turn what should be pleasurable moments into sources of discomfort and anxiety. The solution here isn't to stop all activity, quite the opposite actually. Studies involving over 29,000 men found that regular ejaculation can actually reduce prostate cancer risk by up to 31%. The key is being gentle and mindful. If you're exploring prostate stimulation, whether externally through the perineum or any other method, think of it as a gentle massage rather than aggressive pressure. Your prostate responds much better to consistent, gentle attention than it does to rough handling. This means taking your time, using plenty of lubrication, and listening to your body. If something hurts, even a little bit, that's your body telling you to back off. Pain is never normal during sexual activity, and it's definitely not something you should try to push through. Your body will thank you for treating it with the respect and care it deserves at this stage of your life. Here's something that might surprise you. One of the biggest mistakes isn't doing too much, but doing too little. Many men over 60, perhaps due to decreased libido, medication side effects, or just societal stigma around older men having sexual desires, dramatically reduce their sexual activity, including masturbation. But here's what the science tells us. Infrequent ejaculation might actually increase your risk of prostate problems. Researchers found that men who ejaculated between 4 to 7 times per week were 36% less likely to develop prostate cancer before age 70 compared to those who ejaculated less than 2 or 3 times per month. Think about that for a moment. We're talking about a significant reduction in cancer risk just from maintaining regular sexual activity. That's better than many medications or supplements promise. The theory behind this is fascinating. Scientists call it the prostate stagnation hypothesis. Essentially, your prostate is constantly producing fluid. That's its job 24 hours a day, 7 days a week. When this fluid isn't regularly expelled through ejaculation, it can stagnate, potentially allowing harmful substances to build up. Think of it like a river versus a stagnant pond. The moving water in a river stays fresh and clean, while the still water in a pond can develop problems. Regular ejaculation flushes out these substances, keeping your prostate healthier. But here's where men make another critical mistake. They think if some is good, more must be better. That's not necessarily true either. Compulsive masturbation that interferes with your daily life, relationships, or causes physical discomfort is problematic. Some men, worried about their prostate health, suddenly try to dramatically increase their frequency, which can lead to soreness, irritation, or even injury. The goal is finding your personal sweet spot, regular enough to maintain prostate health, but not so frequent that it becomes problematic or uncomfortable. For most men over 60, this might mean adjusting expectations and being more intentional about maintaining regular sexual activity, whether solo or with a partner. Now, let's address something that many men are too embarrassed to discuss with their doctors: the products they use during masturbation. This is where I see some of the most dangerous mistakes happening, and they can have serious consequences for your prostate health that extend far beyond the immediate moment. First, let's talk about lubricants. I can't tell you how many men reach for whatever's handy: hand lotion, petroleum jelly, even cooking oil or bar soap. But here's what you need to know. Your urethra and the delicate tissues around your prostate are not designed to handle these substances. They're incredibly sensitive, and what seems harmless on your hands can be devastating to these internal tissues. Petroleum-based products like Vaseline can trap bacteria, creating the perfect environment for infections to develop. These infections can travel up your urethra to your prostate, causing prostatitis, a painful condition that can take weeks or even months to resolve. Lotions with fragrances, alcohol, and preservatives can cause chemical burns, allergic reactions, and long-term tissue damage. And believe it or not, I've heard from doctors about men using everything from butter to motor oil. Please, for the love of your health, never do this. The safe choice is actually simple, though it might require a slightly embarrassing trip to the pharmacy or an online purchase. Water-based or silicone-based personal lubricants designed specifically for intimate use. Yes, it means having an actual conversation at the pharmacy counter or clicking Add to Cart on a website, but your prostate health is worth that momentary discomfort. These products are pH balanced for intimate tissues, won't harbor dangerous bacteria, and won't damage the delicate membranes you're trying to protect. But products aren't the only issue. Some men, in their quest for new sensations or trying to recapture the intensity of their younger years, use household objects that were never designed for intimate use. The emergency room statistics on this are sobering. Thousands of men each year end up seeking medical help for injuries caused by inappropriate objects. Sharp edges, breakable materials, objects with toxic coatings, or items that can get lost inside the body pose serious risks not just to your immediate health, but to your long-term prostate function. If you're interested in toys or tools designed for prostate stimulation, invest in products specifically designed for that purpose. They're made from body-safe materials, have flared bases to prevent them from getting lost, and are designed with the anatomy and sensitivity of the prostate in mind. Your health is worth the investment in proper equipment. Here's a mistake that even well-informed men make: ignoring the timing of their sexual activity in relation to their medical conditions, treatments, or medications. Your prostate doesn't exist in isolation. It's part of a complex system that can be significantly affected by various health conditions and the medications used to treat them. If you have acute bacterial prostatitis, that's an active infection in your prostate, stimulation can actually spread the infection throughout your body, potentially leading to sepsis, a life-threatening condition. The signs of acute prostatitis include fever, chills, burning urination, pelvic pain, and sometimes flu-like symptoms. If you're experiencing any of these, sexual activity should be off the table until you've been properly treated and cleared by your doctor. Similarly, if you've been diagnosed with prostate cancer, vigorous stimulation could potentially disturb cancer cells, though more research is needed in this area. This doesn't mean you need to give up sexual activity entirely, but it does mean having a frank conversation with your oncologist about what's safe and what's not during your treatment and recovery. Many medications affect your prostate and sexual function too, and understanding these effects can help you avoid unnecessary worry or dangerous interactions. Alpha blockers like tamsulosin, commonly prescribed for enlarged prostates, can cause retrograde ejaculation, where semen goes backward into your bladder instead of out through your penis. While this isn't dangerous, it can be alarming if you don't expect it. You might notice that your orgasms feel different, or that there's very little or no visible ejaculation. 5-alpha reductase inhibitors like finasteride can reduce ejaculation volume and potentially affect libido. Some blood pressure medications can affect your ability to achieve or maintain erections. Antidepressants, particularly SSRIs, can delay or prevent orgasm entirely. None of this means you should stop taking your medications, but it does mean you need to understand how they might affect your sexual experience. The solution isn't to stop taking your medications or to give up sexual activity. Instead, it's about having open conversations with your healthcare provider about how to maintain sexual health while managing your medical conditions. Too many men suffer in silence, assuming that sexual side effects are just something they have to live with. That's simply not true in most cases. There are often alternative medications, timing adjustments, or supplementary treatments that can help. Now let's talk about something that should be obvious but often isn't: hygiene. As we age, our immune systems become less robust, making us more susceptible to infections. Yet many men don't adjust their hygiene habits accordingly, and this can have serious consequences for prostate health. Before any intimate activity, whether alone or with a partner, washing your hands thoroughly is absolutely crucial. I'm talking about a full 20 seconds with soap and warm water, getting under the nails and between the fingers. This isn't just good manners, it's essential health protection. Your hands touch countless surfaces throughout the day, picking up bacteria that could cause serious problems if introduced to your sensitive, intimate areas. If you're going to engage in any anal play or direct prostate stimulation, this becomes even more critical. The bacteria that naturally live in the anal area aren't necessarily harmful where they belong, but they can cause serious infections if introduced to your urethra or prostate. This is why many doctors recommend having a dedicated hand-washing routine before any intimate activity, not just a quick rinse under the faucet. After ejaculation, many men make the mistake of simply cleaning up and going about their day. But here's a tip that could save you from a urinary tract infection. Always urinate after sexual activity. This helps flush out any bacteria that might have entered your urethra during arousal or orgasm. It's a simple step that takes just a minute but can prevent weeks of discomfort and medical treatment. Also, pay attention to how you clean your intimate areas in general. Harsh soaps, antibacterial gels, or vigorous scrubbing can disrupt the natural bacterial balance and actually increase infection risk. Your skin in these areas has its own delicate ecosystem, and being too aggressive in cleaning can do more harm than good. Use mild, unscented soap and warm water, and be gentle. Your skin down there is more delicate than you might think, especially as you age and the tissues become thinner and more sensitive. Don't forget about your environment either. The surfaces where you engage in intimate activity should be clean. This means fresh sheets, clean towels, and making sure any toys or tools you use are properly sanitized before and after use. It might seem like overkill, but preventing an infection is always easier than treating one. One of the biggest mistakes men make isn't about technique or frequency. It's ignoring their body's warning signals. Your body is remarkably good at telling you when something's wrong, but you have to be willing to listen and take action when it speaks to you. Pain during ejaculation is never normal. Let me repeat that. Pain during ejaculation is never normal. Yet many men experience this and assume it's just part of getting older. It's not. Sharp, burning, aching, or cramping pain during or after orgasm could indicate prostatitis, an infection, kidney stones, or other serious conditions that need medical attention. Don't tough it out or hope it goes away. Get it checked. Blood in your semen or urine is another red flag that too many men ignore or downplay. They might notice a pink tinge, rust-colored streaks, or small clots and convince themselves it's nothing serious. While it could be something relatively minor like a broken blood vessel from vigorous activity, it could also indicate something more serious like prostate cancer, bladder problems, or urethral damage. Any blood in your semen or urine deserves an immediate conversation with your doctor. Changes in ejaculation volume, consistency, or force can also provide important clues about your prostate health. If you notice your ejaculation volume has decreased significantly, not just the normal gradual decline that comes with age, but a sudden or dramatic change, this could indicate problems with your prostate function. Similarly, If your orgasms have become painful, much weaker, or less satisfying, these aren't just inconveniences. They're your body's way of asking for help. Pay attention to urination changes too. If you're suddenly having to get up multiple times during the night, if your urine stream has become noticeably weaker, if you feel like you can't completely empty your bladder, or if you're experiencing burning or urgency, these could all be signs of prostate problems that masturbation habits might be affecting. Other warning signs include persistent pelvic pain, pain in your lower back or thighs that seems connected to sexual activity, or any unusual discharge. Some men also experience what feels like pressure or fullness in their rectum, especially after ejaculation. None of these symptoms should be ignored or dismissed as normal aging. Here's something that often gets overlooked in discussions about prostate health: the profound connection between your mental state and your physical health. Stress, anxiety, and depression don't just affect your mood. They can have real, measurable impacts on your prostate and your overall sexual health. When you're stressed, your body produces hormones like cortisol that can increase inflammation throughout your body, including in your prostate. Chronic stress has been linked to worse outcomes in men with prostate conditions. Think about it. When you're constantly worried about work, family, finances, or health issues, your body is in a constant state of alert. This chronic inflammation can make existing prostate problems worse and potentially contribute to new ones developing. So what should you be doing to protect your prostate while maintaining a healthy sex life? Let me paint you a picture of the ideal approach based on all the medical research we've discussed. First, maintain regular sexual activity, whether that's with a partner or through masturbation. Aim for ejaculation at least 4 to 7 times per week if possible. Remember, this isn't a performance requirement, it's a health recommendation, like exercising or eating vegetables. When you do masturbate, be gentle with yourself. Use plenty of appropriate lubricant, water-based or silicone-based products designed for intimate use. Take your time. This isn't a race, and rushing can lead to rough handling that could damage delicate tissues. Pay attention to your position and comfort. Many men find that lying on their back with proper support reduces strain on the pelvic floor muscles. If you have back problems, try lying on your side. The key is finding what works for your body without causing strain or discomfort. If you're interested in prostate stimulation, approach it carefully and with proper preparation. Always ensure your hands are clean, nails are trimmed and filed smooth, and you're using appropriate lubricant. Start gently and listen to your body. If something hurts, stop immediately. Your prostate health isn't determined solely by what happens during intimate moments. Your overall lifestyle plays a crucial role in maintaining prostate health as you age. Diet matters more than most men realize. Research shows that a Mediterranean-style diet rich in fruits, vegetables, and healthy fats can significantly reduce prostate problems. Tomatoes, especially cooked ones, contain lycopene, which has been shown to benefit prostate health. Green tea, pomegranate juice, and foods rich in omega-3 fatty acids like salmon also show promise in protecting prostate health. Exercise is equally important. Men who maintain regular physical activity have lower rates of prostate problems. But here's the catch. Long periods of sitting, especially on hard surfaces like bicycle seats, can actually worsen prostate symptoms. If you're a cyclist, invest in a prostate-friendly seat. If you have a desk job, make sure to stand and move regularly throughout the day. Weight management becomes increasingly important as we age. Excess weight, especially around the midsection, is associated with increased prostate problems. Every pound of excess weight puts additional pressure on your pelvic area and can worsen symptoms of an enlarged prostate. Sleep quality also affects prostate health. Poor sleep can increase inflammation throughout your body and may worsen prostate symptoms. If you're getting up multiple times at night to urinate, it creates a cycle of poor sleep and worsening symptoms. Talk to your doctor about strategies to improve both your sleep and nighttime urination. One of the biggest obstacles to prostate health isn't medical, it's communication. Too many men suffer in silence, too embarrassed to discuss these issues with their healthcare providers or even their partners. Here's how to start the conversation with your doctor. Write down your symptoms before your appointment. Be specific about when they started, how often they occur, and how they're affecting your life. Don't minimize or downplay things because you're embarrassed. Your doctor has heard it all before, and they need accurate information to help you. Ask direct questions. Is my sexual frequency affecting my prostate health? Are there techniques I should avoid? How do my medications interact with sexual activity? These are all perfectly appropriate questions that your doctor should be happy to answer. If your doctor seems dismissive or uncomfortable discussing sexual health, it might be time to find a new doctor. Your sexual health is an important part of your overall health, and you deserve a healthcare provider who recognizes that. With partners, communication is equally important. Many couples find that age-related changes actually improve their sex lives by forcing them to slow down, communicate more, and explore new forms of intimacy. Be honest about what feels good and what doesn't. Your partner wants you to be healthy and comfortable just as much as you do. Your body is designed to remain sexual throughout your life. Yes, things change. Erections might take longer to achieve, ejaculation volume might decrease, and recovery time between sessions might increase, but these are adaptations, not failures. Your body is adjusting to continue functioning in a way that's appropriate for your age. The men who maintain the best prostate health as they age are those who adapt rather than give up. They adjust their techniques, maintain regular activity, pay attention to their overall health, and aren't afraid to seek help when needed. They understand that sexual health is just health, period. With the right knowledge, appropriate techniques, and a willingness to adapt to your changing body, you can maintain a healthy prostate and enjoyable sex life for many years to come. Your future self, the man you'll be at 70, 80, and beyond, will thank you for the care and attention you give to your prostate health today. Stay healthy, stay informed, and remember, it's never too late to start taking better care of yourself. Your body is remarkably good at healing and adapting when you give it the support it needs.